So hello friends, in this video we will discuss about dental implant cost. At some places you will see the implant cost is nearly 20,000 and in some places you will find it 50,000, 60,000 or 80,000. So what is the secret behind it? We'll discuss or disclose in this video. So my name is Professor Dr. Sharad Arya. I'm doing implants from last 20 years. So as per my expertise, I'll give you the brief insight how the cost is being decided in every type and every situation in the implants. So as for a general knowledge for everyone, we should not straight away rush for the final cost. We should have a consultation where we are sitting with our doctors and discussing about our medical conditions and the age and other habits. So during the discussion, we can find out various important factors like your age, your available bone, and what is the condition inside the mouth of your gums and the teeth. So according to your medical health, your age and condition, doctor can give you 2-3 references. So these are the intermediate or the expensive implants. Out of those, you can discuss any type or you can select any brand as per your need. But before deciding the cost, I would always suggest to everyone to sit with your doctors and have a detailed conversation about your habits, your needs, and your finances. Because once you will sit with the doctor, then only they will understand what is your special need, what is your condition, and what comes into your financial comfortability. So understanding after the consultation cost is being justified. But to understand this video, I'll give you a brief insight how the cost is being generally, not in a routine life, but in generally how it is being decided. So variably there are 3 to 4 factors, but primarily we can say the cost of implant in a general terms can be decided by the brand of the implant also. So there is a lot of type of brands available in the market. So from the scratch we can say, if we are living in India, so we are having the dental implants which is being manufactured in our country. So those implants could be the cheapest implant available in the market, but sometimes we won't advise you such implants because they are very new into the market and they are not very much backed by the science and research, because they hardly into the market from for last 5 to 10 years. But if you asked about the implants, these are the medical devices and in which those are the brands which is highly backed by the research and by the clinical trials all across the world. We are finding those brands are either made by Germany, Switzerland, or made in US. So those are the most expensive implants because they have done extensive research how to make not only the implants, all of the component so nicely fitted without causing any, I would say, the loosening of the components. So in that way the cost could generally be standardized as per the choice. So if I decide the categories, on the bottom line we can start from the Indian implants that could range from 10,000 to 15,000. If we go into the next category, that could be Israeli made implants. Those costs could range from 25,000 to 35,000 rupees. And if we go a little up, then we can say the Korean implants. These implants is made by Korea, as we say it. So it could start from 25,000 to 45,000 rupees. And finally, as I told you, the most research backed implant, those are made in Germany, US, or Switzerland, are little expensive or comes into the premium categories. Those are like Noble Biocare, Straumann, Breed, and those are the expensive categories. And not only the implants are expensive, all the components of those implants are expensive. So we can say implant is a screw or a fixture which goes inside the bone, but top of that we have to place an abutment or a kind of a neck screw on which we have to place the crown. So other than that, other than the cost of the implant, we should consider what is the cost of the fixtures or the attachments, because sometimes the attachment cost is nearly a cost of the other implants which are generally available in the market. So I would suggest you, before going for the finalization of the cost, we also consider what could be the cost of other components, because sometimes in the mouth the space between the upper jaw and lower jaw is less and we place the implant and we have not calculated the space between the arches. After finishing the implants, your surgeon, your expert will ask you, okay, here we are going to make a different type of crown which we have to be made customized, and to make a customized crown we have to charge you separately 10,000 or 15,000. Or sometimes not only the type, or I would say the type of the screw or attachment, sometimes the type of the crown, top of that could be a different cost, like it can be made of metal, ceramic, sometimes it is metal free zirconia, and the technology also, it is being made by CAD CAM or by simple casting method. So all these factors contribute to the finalization of the cost. So I would suggest, if you really want to understand the cost of an implant, you should sit with your doctors, have a nice consultation, take all of your records and with your medical history. Once you are finalized with everything, then you say your financial comfortability with the doctors. And once they will say you, okay, my friend, these are the two, three different available options. Out of that, you can choose these are the premium one or intermediate one and the lowest one. So before finalizing the cost, you should consider all the limitation of all implant system, because in some implants, what we have generally seen, the available length, I mean, how long the implant should be. So every company has a different sizes also. So we have to consider everything during the consultation so that no surprises should be seen in the later phases. So if you have any queries regarding to this video, my name is Professor Dr. Sharad Arya. You can type me your complaints on the given number on the given link, and I will definitely love to help you. Thank you.